Dr. Adam Jones with the Phoebe Cancer Center is here today to talk to us about prostate cancer. We don't often hear as much about prostate cancer as, say, breast cancer, but it actually is as common in men as breast cancer is in women, isn't it? And it's also can be deadly.
Absolutely. September is a special month for us. It gives us a chance to reflect on things important to our community, and prostate cancer is a massive problem. We have a high-risk population. Our Black population is at risk to get prostate cancer at an earlier age and more advanced cancer at that. And many times it's our population that's really afraid to talk about it or really afraid to go to the doctor. And I always joke with my male patients that the females are better organized. They speak louder and they're better advocates for themselves. So yeah, this is an important month and it's an important thing to talk about.
Early detection really is the key to successful treatment, isn't it? So when should we start getting screened and how often?
Absolutely. So screening is with a simple blood test called PSA. Fortunately, we've had PSA since the 90s. It's a simple blood draw. So it's something that men should engage with their primary doctor. My personal rule of thumb is get a baseline screen in your 40s, perhaps younger if you're higher risk or have a family history of prostate cancer. But everyone absolutely by the age of 45 or 50. And at that point, can be done annually or every other year depending on what makes sense for you. As we age, sometimes it makes sense to screen less or less often. So that's kind of a personal decision between the patient and their doctor.
Let's reiterate the screening. I think a lot of guys don't go to the doctor as often as we should anyway, and particularly kind of shy away from prostate cancer screening because they might think it's something uncomfortable or invasive, and it's not.
That's right. So the prostate is sandwiched between the bladder and the rectum, and back in the day, before the blood test, all we had was the digital rectal exam. And we still, as men, think about that today, which scares us from going to the doctor. It's a simple blood draw, can be added in with your annual cholesterol check or blood check. So it's something that can be done very easily.
Are there symptoms that we should be aware of with prostate cancer?
So there's really no symptoms. Now, a person with an advanced cancer can have symptoms. And typically those present because the cancer's in different organs or compressing organs. But early on, and again, that's the time to catch it or the time to detect it, there's no symptoms. It's just a blood test. So you really wouldn't know unless you had the screening test done.
So if we go get that screening and it shows that it's elevated, we come in, we find out that we have prostate cancer, what are typical treatments?
Yeah, so the beauty of finding out is initially, oftentimes you don't have to do anything. There's a very well laid out surveillance pathway that we follow. It's even recommended in men with very early stage or very low risk disease. And while that's considered a treatment option, it just means you're being actively followed. Outside of that, cancer treatment, specifically for the prostate, has gotten so good the past couple of years. The surgical process has gotten better, more advanced with robotics. On the radiation side, it's also improved just as technology improves. So as a rule of thumb, if cancer is found localized, it is curable almost always, almost all of the time. As the cancer becomes more advanced or maybe it's found later, the cure rates do drop with that staging.
But we have very advanced treatment options right here in Albany, right?
Absolutely. So Phoebe has two different Da Vinci robotic surgery arms, and our surgeons here are capable of using those. On the radiation side, we're blessed with the most advanced technology that we need here. It's a general agreement between ourselves and Phoebe about what we need to invest in locally. We also have a robust brachytherapy or radiation seed program, and we use a lot of new devices to help protect the organs around, such as SpaceOAR and other things.
I know you've been involved in a really important project called the Elevation Project in the community that really is trying to get those at-risk folks screened. Talk to us just a little bit about that.
So Project Elevation, and I was fortunate to be asked to just help with the education piece. And really this is a relationship, a bridge between academia, so Morehouse University, and Mount Zion Church here locally. and then Phoebe through their outreach program. So really this was a novel way to help educate men in their own environment, whether it be church or even in the barber shop. So I've had the luxury of just watching this process over the years, but really a lot of grassroots work done in the church and through the outreach department. So initially, I believe more than 500 men were screened through the initial push. And in that, there were education of several champions within several churches in the community. A lot of these guys came together for different weekend education sessions. And then that built into a secondary project, which is recently been announced or launched. So essentially an even larger project between Morehouse, the church, and the outreach. So I think the goal is to double or triple the amount of men screened and bring them to a place where they can get more comfortable just with their own health in terms of seeking a primary doctor or looking for other ways to kind of get healthy.
Great program. Appreciate you being involved in it, and thanks for spending some time with us today.
Absolutely. Thanks, Ben.